It's a very simple American dream story. I became valedictorian in high school and always did well academically. Graduated from an engineering school with a degree in aeronautical engineering. I spent a little over 3 years in active duty in the Air Force as a B-52 Special Weapons Officer. I met my wife in San Francisco. I proposed in Madrid and we got married in St. Patrick's in 1965. We have 3 daughters. Next month, we'll be married 58 years. It is just a fantastic love story. In 2011, I had a physical in Greenwich, Connecticut. A lady took my blood and did tests, and then called me up later and said I should see a hematologist. So I went to see a hematologist, and he explained that I had CLL. My name is Carlos, and I have chronic lymphocytic leukemia called CLL.
I am a hematology-oncology doctor by training, but I do a specialization in lymphoma and in CLL. So that's my area of research. Does that mean that only older people have the disease? No, you can be very young and have it. I've actually had some women that discovered that they had CLL when they were pregnant. So it can be a big range, but the majority of patients are diagnosed in their 70s. CLL stands for chronic lymphocytic leukemia, meaning it's a chronic disease. Lymphocytic means it has activity in the lymphocytes, and leukemia means an elevation of your white blood cell count. There's 2 main white blood cells. One is called neutrophils and the other one is called lymphocytes. Lymphocytes are produced mainly in the bone marrow. So B lymphocytes are produced in the bone marrow. And CLL is a disease of the B lymphocytes.
When I was initially diagnosed, I had no symptoms, and the doctor said that I should be under watch and wait, which is stage 0.
There's 5 different stages. Stage 0 means you only have lymphocyte count elevated. Stage 1 means you have not only the lymphocyte count elevated, but also you have lymph nodes that are enlarged. Stage 2 is when you have an spleen that is enlarged. Stage 3 is patients that have anemia or hemoglobin that is below normal. And stage 4 is when patients have low platelets.
In 2011, I was stage 0. And slowly that stage began to increase. In November of 13, I was stage 4.
And the doctor said in the room, you have stage 4 CLL. And you could have sucked the air out of the room. It was dead silent. We got to the car, and he looks at me and goes, wow, I have stage 4. And that was a wake-up call for all of us. And that's when the treatment path began. The cancer doctor in Connecticut at the time really only dealt in serious cancer. My dad, obviously CLL is considered a serious cancer, but this doctor's perspective, because he had stage 4, it was chemotherapy. That was it, chemo.
Carlos has an amazing support mechanism, and his daughter actually moved to help him. So it's you don't see that anymore.
I'm gonna see that play. Both my wife and I are greatly blessed in that our middle daughter has decided to stop her business to help us. And she provides a lot of service to both my wife and myself in meals, in taking me to the doctor to Miami, where Dr. Barrientos is.
you hear chemo in any family, and you really should take it with a grain of salt and say, okay, let's stop, let's see what other treatments are out there. And my dad having 3 daughters, we did a lot of research and met with several doctors to find out what they were doing about CLL, until we actually found Dr. Barrientos.
I have a personal story. My mom actually had lymphoma when I was a child, and I saw how hard it was for her to have chemotherapy. So I promised myself that I would work to be involved in research for novel targeted agents that can change the way that people feel, be in remission, but without having all the side effects of the chemotherapy.
He couldn't qualify for the clinical trial because his lymph nodes weren't large enough. It was a waiting game until they approved it. When the FDA approved it, he literally was on it 2 days later.
And we started using it on him, and he went into remission pretty quickly.
And then I was normal for about 2 years without the drug, when CLL began to raise its head again.
His hemoglobin had dropped. So Dr. Barrientos put him on a steroid to get his numbers back up, and then we talked about a new drug that was coming out.
So with the arrival of the targeted therapies, we can keep the patients in remission for many, many years. Back in the days when we used chemotherapy, some patients tended to relapse much sooner. But now with targeted agents, those patients can expect to have a very good remission duration throughout their lifespan. So as of today, we don't have a cure, but there's about 50 more types currently in clinical development and in research. So I always recommend to physicians to please send their patients to clinical trials, because there might be something else and we have not exhausted all the available therapies.
So we're on a new treatment, and we take it day by day. My dad's always optimistic.
The B58 hustler is the convert, and this is its pod. My daughters have been 100% supportive of my illness and whatever they could do to help. So I am blessed in that regard.
What a great book. Dr. Barrientos is the best. She truly is. And we really do think we live in her heart. There's no good cancers, but there are a lot of people living with CLL. This is a disease that they actually have treatment, and people live long, happy, fulfilled lives. I think his optimism is mostly due to her and the love they have. You can see the way he looks at her, and she looks at him. And it's just a love story that is admirable, and I think something we should all aspire to in 58 years.
I think the most important thing to know about CLL is that you should not give in to the concept that it is terminal. We're all terminal. But the idea is to live with it, see how you can handle it best, and understand that you're getting the best treatment for it, and be in a cohesion with the doctor who is providing it. That's my advice.